Yes, now we will also do the drawing. Now, while doing the drawing, open your eyes a bit, close them. Look, this is actually the exact curve point of our patient. Open your eyes again. Close. Look, I'm not entering exactly from here, friends. Close. Because if I enter from here, this distance is too long. Look like this. Please close your eyes.
About 1 centimeter. That's too much because then it becomes a bit.
For me, 6 to 7 millimeters here is enough. So I will enter from here.
Look, friends, like this. Just now, our patient asked if there would be a scar if it comes out on the sides. Actually, if done properly on the sides, there won't be a scar. It won't be very noticeable. If we don't slide too much to the side, I mean, if I don't slide too much towards these outer areas, it turns out bad. Why? Because this part gets taken and it piles up here. That pile bothers the patients. So this is actually a bit of experience, friends. Secondly, being a plastic surgeon is already the biggest advantage, friends, because we often encounter such incisions. I have a rough idea of which will yield better results. For example, I don't move it too far outward. Look, it's almost at the same place as the eyebrow's edge. So I don't move it too far outward. Yes, now you see the crease point of our patient here. Look, this is it. I'm not drawing an ellipse here, friends. I start drawing from underneath this. Look from this part. Okay, what we will do, friends, close your eyes, open them. We will make the incision within the lines we have drawn. And this is completely natural. For years, it's been established and tested. I mean, I've been doing it with this technique for almost 30 years. So for the last 30 years, I've been doing it this way by cutting, and patient satisfaction is very high. I don't have to do it again. Please come closer again. Look, while doing this, close your eyes. Look, here, you will set the back, friends. There is also a bag inside here. If I remove some of those bags, then the piling effect over the eye will be completely gone. Removing too much skin is not a skill, nor is removing too little. If you remove too little, what we call residue, meaning excess, will still remain. This will bother the patient. If you remove too much, then it will shorten this distance of the eye. This is not the appearance we desire or want. Therefore, this is entirely related to the doctor's skill, technique, and ability. It is very much related to their experience. That's why you shouldn't underestimate eyelids. Friends, I don't use dissolvable stitches. I especially say this for patients coming from outside Istanbul. Now, the eyelid skin is thin. Here, even if we use dissolvable stitches as thin as a hair strand, it takes about 1 to 2 months for those stitches to dissolve. During that 1 to 2 months, the body does what? There is a wound healing form, hardness occurs, redness occurs. So the dissolving of the stitch there is actually related to the stitch not being accepted, being rejected. During this period, the disease causes redness and swelling there, and these bother the patients. That's why in this area, look, I use it everywhere else. There's no problem. But for this area, the skin is thin. So it needs to be removable stitches, and we remove them on the 5th day. So it's a 5-day period, and our patient already lives in Istanbul. There's no problem in this regard. For patients who don't live in Istanbul, how do I do that stitch? For example, there are only 2 or 3 things to be removed, knots. I am explaining. Most can even do it themselves. So it can be done in just 1 day. But if you live in Istanbul, we already do a check on the 5th day, which is also when we remove the stitches.